Hello everyone, welcome to my YouTube channel. It's the 5-Foot Doctor. If you are just meeting me for the first time, I am a podiatrist and foot and ankle surgeon, and this channel just kind of talks about health, fashion, and lifestyle. Welcome. Today we're going to be talking about nail discoloration and the causes of nail discoloration. I am sure lots of people have different colored toenails and they look at their toenails and they're wondering what could be causing that? What could be causing this? Why is this green? Why is this brown? Why is this yellow? Well, today I'm here to educate you guys on some of the causes that could be resulting in your nails being discolored. One of the most common causes is toenail fungus, and what that is when your toenail, the nail matrix, the nail bed, the nail plate is infected with fungi, and that could have different colors that could range from yellow, brown, or even black. If you see this, the way that you can diagnose this is by definitely getting a test, okay? And you get this test by going to your foot doctor or any of your doctors that may be able to perform this test, and they take some of the nail plates, the nail bed, some of the debris, the gunk under your toenail. They'll gather all of that and send it out to the pathologist and send it out to the lab, and then they would look at that and be able to diagnose it. And once that's diagnosed, your doctor will be able to give you the medications that'll help to treat this. Some people may ask, where do you get toenail fungus from? Like, how do you even get it? I like and I love this saying, fungus is among us. I got that from my dermatology professor in medical school. Fungus is among us. It's everywhere. So you could be as clean, squeaky clean, and still get it. You know, you could get it from the nail shop. You could get it from, just walking around. It's everywhere. We just hope that once you catch it, we can, get to it on time and try to cure it as soon as possible. Another common cause of toenail discoloration is actually a bacterial infection. So of course, like you may have figured out, bacteria are different from fungi or fungus. So a bacterial infection could be happening in your toenail, and sometimes they call that chloronychia. A lot of the times when it's a bacterial infection, you would see that it's green, and that's caused by bacteria called Pseudomonas. A lot of the times you would also actually see this in patients who have like the fake nails, the acrylic nails, or the press-on nails, and who've left it on there for quite a while. And what could happen is maybe going about their activities of daily living, doing dishes, washing their hands and things like that. Especially in these times, the water could settle in there, and that could just cause an environment that would just make bacteria thrive. So a lot of the times, especially for those who do wear the acrylic nails, once they take it out, they may see that there is a green tinge that is present there. And when you see that, a lot of the times that is a bacterial infection. I must say, fungi and bacteria, especially fungi, they like places that are warm, that are wet, and that are dark. So imagine an acrylic nail would be a perfect place to be able to host a fungi or even a bacteria. It's not to say that you shouldn't wear your acrylic nails or your press-on nails and things like that. No, it just means that the frequency of changing those may need to increase. We can't wear them for such a long time because that could just be a perfect environment to grow these bugs. Another common cause of discolored toenails is a subungual hematoma. And what that is when you have a big bruise or bleeding spot under your toenail. This could result from trauma, maybe a major trauma. You drop a can of soup on your toe, or you stub your toe against a bedside or a lamppost, or some of the little side coffee tables. I know some of us have done that, and that is just awful. So sometimes you could have trauma where you bleed under the toenail, and when you do that, yes, initially it may be red, but after a while it may turn to brown and then black after the blood has sort of, the older the blood gets. So sometimes that could be the reason why you have discolored toenails. Again, if you do have discolored toenails, I will advise that you go see your doctor, because they would be the best person to help diagnose and find out why there is the discoloration in your toenail. Another cause of toenail discoloration could be several health conditions that you have that you may or may not know. Some of those conditions could include psoriasis, cirrhosis of the liver, or even kidney problems. So yes, I am a podiatrist. Yes, I focus on the foot and the ankle, but a lot of the times, some of the systemic diseases that people have from head to toe do manifest in the foot and the ankle. So it is imperative that you do follow up, with all your healthcare providers so that they can really help to figure out if there's anything that's going on. So imagine you come and your podiatrist looks at you and is able to kind of figure out that there may be something going on with your kidneys. It'd be, such a lifesaver then when you're being directed to the appropriate physician that can properly treat the underlying systemic cause of your nail discoloration. There are people who do have what they call yellow nail syndrome, and so these patients have yellow discolored nails. A lot of the times you see that in patients that are over 50 years old. And some of the times the things that could cause this are bronchitis, sinusitis, lymphedema, pleural effusion, or rheumatoid arthritis. So these are just some of the differential diagnoses that someone who may come in with just yellow nails could have. And so when you see a patient like that, or you see a friend like that, or you see a family member like that, you could start to think of some of the things that could be causing it and then direct them to the appropriate healthcare provider. Another potential cause is medications. As we know, cancer is quite prevalent, and a lot of cancer patients who've been on chemo or radiation will attest to this. A lot of the times, they will find out that their nails have turned after being on these very, very strong medications. So that's something that could be causing your nail to be abnormal or look a certain way that is not how it looked before. Ultimately, I will still advise that you go see a healthcare provider so that they can help you figure out what's going on. And last but not least, because there are definitely lots of other causes of nail discoloration, but I think this is one of the most important ones that you want to pay attention to, is melanoma, but specifically for the toenails, subungual melanoma. The reason this is because this is a malignant cancer. It is a malignant tumor that could show up in the toenails. So subungual melanoma is, a discoloration. You would see it in the toes and you would see it around the toenail. And I will make a separate video that focuses on that because that is such a big topic and I think that people should be educated about it. So don't worry, even if I'm skimming over it now, these are just listing the different causes. Again, I'm going to break melanoma down, focus on it so that you guys can get more insight on what you should look for and what you should do if you think you have that. And I will stress, you should definitely go see your provider if you're just concerned about any discoloration that just comes suddenly and you are not expecting it. So all in all, these are the most common reasons why you would see nail discoloration, whatever color it is. So I'm going to make another video, so make sure you check out for that. That is going to talk about toenail fungus and some of the home remedies that you can use to actually get rid of the toenail fungus. Of course, at a certain stage, if it's really bad, we may need medications and things like that. But in the beginning stages of a toenail fungus, there are definitely there are definitely home remedies that we can use to help to treat this. So be on the lookout for that. Thank you guys for sticking with me until the end. I really appreciate it. Please consider subscribing to this channel. If you have any more questions, or if you have any questions, please leave them down in the comment below. Please like this video and also share it with someone that you think may benefit from it. If you have any ideas or tips of other things that you would like for me to talk about on this channel, also leave a comment down below. I would love to get into that and just sort of share my knowledge as far as foot health is concerned.